Okay, this is lesson number 5, the human body. As an emergency medical responder, you require a basic understanding of normal human structure and function. Knowing what the body's structures are and how they work will help you more easily recognize and understand injuries and illnesses. Body systems do not function independently. Each system depends on other systems to function properly. When your body is healthy, your body systems work well together. But an injury or illness in one body part or system will often cause problems in others. Knowing the location and function of the major organs and structures within each body system will help you to more accurately assess a patient's condition and provide the best care. To remember the location of body structures, it is important to visualize the structures that lie beneath the skin. The structures you can see or feel are reference points for locating the internal structures you cannot see or feel. For example, to locate the pulse on either side of the neck, you can use the middle of the throat as a reference point. Using reference points will help you describe the location of injuries and other conditions you may find. This chapter provides you with an overview of important reference points, terminology, and functions of 8 of the body systems. It also focuses on body structure, anatomy, and body function psychology. Okay, on this next slide here, you are the emergency medical responder. So this is a slide that we are going to have to discuss in person, okay? There we go. Just a bit for you. Okay. Your fire rescue unit responds to the scene of a motor vehicle collision involving a car with 2 people and a minivan driven by a woman who has 2 small children in her car seats. As you size up the scene, 3 of the 5 people appear to be injured. The first person, a woman who was driving the car, is going in and out of consciousness. You suspect her injuries may include possible fractured ribs. The second person, a passenger in the same vehicle, has injuries on the right side of the body. The third person, the driver of the minivan, appears to have chest and abdominal injuries, but she is awake and alert and able to speak with you. She is distraught because her children are in the back of the minivan and she is concerned about them. So this is something that we are going to discuss when we are in person, okay? So just think about the scenario and how you will handle it. The next slide we're going to discuss is medical terminology, okay? Cardio. So what does that mean? A cardio is going to refer to the heart or cardiac. Neuro will refer to the nerve or neural. Oral is going to refer to the mouth. Artery or arterial. Hemo will refer to blood. Thermo will always refer to heat. Vas will refer to duct, vessel, or vascular, okay? So you have common prefixes. You have hyper. That's going to be excessive, above, over, or beyond. You're going to have hypo. Hypo is going to mean less than normal or under. Tachi, fast, swift, rapid, accelerated. Brady, that's going to be slow or dull. Okay? Then we're going to have common suffixes. Emic, okay? Like anemic, emia, okay? Or ia, okay? Now, next slide, 62. Okay. Now we're going to talk about directions and locations. Anatomical terms. By knowing a few key locations of structures and how to describe them, you can more accurately recognize a serious injury or illness and communicate with other emergency medical services personnel about a patient's condition. Anterior/posterior. Any part toward the front of the body is anterior. Any part toward the back is posterior. Superior or inferior. Superior describes any part towards the patient's head. Inferior describes any part towards the patient's feet. Frontal or coronal plane. That which divides the body vertically into two planes. Anterior, the patient's front, and posterior, the patient's back. Sagittal or lateral plane. That which describes the bodies vertically into right and left planes. Transverse or axial plane. That which divides the body horizontally into the superior, above the waist, and inferior, below the knees, plane. Okay, now we're going to discuss directions and locations. Continued. The medial and lateral. The terms medial and lateral refer to the midline, an imaginary line running down the middle of the body from the head to the ground and creating right and left halves. Any part toward the midline is medial. Any part away from the midline is lateral. Now we're going to discuss proximal and distal. Proximal refers to any part close to the trunk, chest, abdomen, and pelvis. Distal refers to any part away from the trunk and nearer to the extremities, arms, and legs. Superficial/deep. Superficial refers to any part near the surface of the body. Deep refers to any part far from the surface. Internal/external. Internal refers to the inside and external to the outside of the body. Right, left. Right and left always refer to the patient's right side and left side, not yours. Okay, now we are going to be discussing movements, flexation and extension. Flexion. Flexion is the term used to describe flexing or a bending movement, such as bending at the knee or making a fist. Extension is the opposite of flexion, that is, a straightening movement. The prefix hyper used with either term describes movement beyond the normal position. Positions. As a responder, you will often have to describe a patient's position to other EMS personnel and healthcare providers. Using correct terms will help you communicate the extent of a patient's injury quickly and accurately. Terms used to describe body positions include anatomical position. This position, where the patient stands with body erect and arms down at the sides, palms facing forward, is the basis for all medical terms that refer to the body. The supine position. The patient is lying face up on their back. Prone position. The patient is lying face down on their stomach. Right and left lateral recumbent position. The patient is lying on their left or right side. Fowler's position. The patient is lying on their back with the upper body elevated at a 45-degree to 60-degree angle. Now we're going to discuss body cavities. The organs of the body are located within hollow spaces in the body referred to as body cavities. The 5 major cavities include the cranial cavity, located in the head and is protected by the skull. It contains the brain. Spinal cavity extends from the bottom of the skull to the lower back, is protected by the vertebral spine column and contains the spinal cord. Thoracic cavity, chest cavity, located in the trunk between the diaphragm and the neck and contains the lungs and heart. The rib cage, sternum, and the upper portion of the spine protected. The diaphragm separates the cavity from the abdominal cavity. Abdominal cavity, located in the trunk below the ribs between the diaphragm and the pelvis. It is described using 4 quadrants created by imagining a line from the breastbone down to the lowest point in the pelvis and another one horizontally through the navel. This creates the right and left, upper and lower quadrants. The abdominal cavity contains the organs of digestion and excretion, including the liver, gallbladder, spleen, pancreas, kidneys, stomach, and intestines. Pelvic cavity, located in the pelvis and is the lowest part of the trunk. Contains the bladder, rectum, and internal female reproductive organs. The pelvic bones and the lower portion of the spine protected. Further description of the major organs and their functions are in the next section of this chapter and later chapters. Next slide. Body systems. The human body is a miraculous machine. It performs many complex functions, each of which helps us to live. The human body is made up of billions of different types of cells that contribute in special ways to keep the body functioning normally. Similar cells form together into tissues, and these in turn form together into organs. Vital organs such as the brain, heart, and lungs are organs whose functions are essential for life. Each body system contains a group of organs and other structures that are especially adapted to perform specific body functions needed for life. For example, The circulatory system consists of the heart, blood, and vessels. This system keeps all the parts of the body supplied. With oxygen-rich blood for the body to work properly, all of the following systems must work well together: musculoskeletal, respiratory, circulatory, nervous, integumentary, endocrine, digestive, and genitourinary. So here are functions of the musculoskeletal system. The musculoskeletal system supports the body, protects internal organs, allows movement, stores minerals, produces blood cells, and produces heat. So here are the types of muscles. You have the skeletal, voluntary. Skeletal or voluntary muscles are under the control of the brain and nervous system. These muscles help give the body its shape and make it possible to move when we walk, smile, talk, or move our eyes. The next is the smooth. Smooth muscles are also called involuntary muscles, are made of longer fibers and are found in the walls of tube-like organs, ducts, and blood vessels. They also form much of the intestinal wall. Cardiac. Cardiac muscles are only found in the walls of the heart and share some of the properties of the other two muscle types. They are smooth, like the involuntary muscles, and striated, string-like, like the voluntary muscles. They are a special type of involuntary muscle that controls the heart. Cardiac muscles have the unique property of being able to generate their own impulse independent of the nervous system. Now here we have 6 types of joints, okay? So we have the ball and socket joint. We have here hinge joint. We have a pivot joint. We have a gliding joint. We have saddle joint. And we have condyloid joint, okay? So these are 6 different joints and have different purposes for our body to function. So next we have the skeletal system. The skeleton is made up of 6 sections: the skull, spinal column, thorax, pelvis, and upper and lower extremities. The skull. The skull is made up of 2 main parts, the cranium and the face. The cranium is made up of broad, flat bones that form the top, back, and sides, as well as the front, which house the brain. 13 smaller bones make up the face, as well as the hinged lower jaw, or mandible, which moves freely. Next is the spinal column. The spinal column, or spine, houses and protects the spinal cord. It is the principal support system of the body. The spinal column is made up of 33 small bones called vertebrae, 24 of which are movable. They are divided into 5 sections of the spine: 7 cervical neck, thoracic upper back, lumbar lower back, and 9 sacral lower spine with fused vertebrae, and coccyx tailbone. Next is thorax. The thorax, also known as the chest, is made up of 12 pairs of ribs, the sternum, breastbone, and the thoracic spine. 10 pairs of ribs are attached to the thoracic vertebrae and sternum with cartilage, while the bottom 2 pairs of ribs, known as the floating ribs, are attached only to the thoracic vertebrae. Together, these structures protect the heart and lungs. Next is the pelvis. The pelvis, also known as the hip bones, is made up of several bones, including the ilium, pubis, and ischium. The pelvis supports the intestines and contains the bladder and internal reproductive organs. Next is upper extremities. The upper extremities, or upper limbs, include the shoulders, upper arms, forearms, wrists, and hands. The upper arm bone is the humerus, and the 2 bones in the forearm are the radius and the ulna. The upper extremities are attached to the trunk at the shoulder girdle, made up of a clavicle, collarbone, and scapula, shoulder blade. Next is the lower extremities. The lower extremities, or lower limbs, consist of the hips, upper and lower legs, ankles, and feet. They are attached to the trunk and the hip joints. The upper bone is the femur or thigh bone, and the bones in the lower leg are the tibia and fibula. The kneecap is a small triangular shaped bone, also called the patella. So the next slide that we're covering is the respiratory system. The body can only store enough oxygen to last for a few minutes. The simple acts of inhalation and exhalation in a healthy person are sufficient to supply normal oxygen needs. If for some reason the oxygen supply is cut off, the brain cells will begin to die in about 4 to 6 minutes, with certain permanent brain damage occurring after 10 minutes. The respiratory system delivers organs to the body and removes carbon dioxide from it. It is a process called respiration. We're going to discuss the upper airway. The upper airway includes the nose, mouth, and teeth, tongue, and jaw, larynx, and esophagus. During inspiration, air enters the body through the nose and mouth, where it is warmed and moistened. Air entering through the nose passes through the nasal pharynx, part of the throat posterior to the nose, and air entering the mouth travels through the oropharynx. The air then continues down the larynx, which houses the vocal cords. The epiglottis, a leaf-shaped structure, folds down over the top of the trachea during swallowing to prevent foreign objects from entering the trachea. Lower airway structures. The lower airway consists of the trachea, windpipe, bronchi, lungs, broncholius, and alveoli. Once the air passes through the larynx, it travels down the trachea. The passageway to the lungs. The trachea is made up of rings of cartilage and is the part that can be felt at the front of the neck. Once air travels down the trachea, it reaches the two bronchi, which branch off, one to each lung. These two bronchi continue to branch off into smaller and smaller passages called bronchioles, like the branches of a tree. At the ends of each bronchiole are tiny air sacs called alveoli, each surrounded by capillaries, tiny blood vessels. These are the site of carbon dioxide and oxygen exchange in the blood. The lungs are the principal organs of respiration and house millions of tiny alveolar sacs. During inspiration, the thoracic muscles contract, and this moves the ribs toward onward and upward. At the same time, the diaphragm contracts and pushes down, allowing the chest cavity to expand and the lungs to fill with air. Oxygen and carbon dioxide are exchanged in the lungs through the walls of the alveoli and capillaries. In this exchange, oxygen-rich enters the alveoli during each inspiration and passes through the capillary walls into the bloodstream. On each exhalation, carbon dioxide and other waste gases pass through the capillary walls into the alveoli to be exhaled. Now we're going to discuss the circulatory system. The circulatory system consists of the heart, blood vessels, and blood. It is responsible for delivering oxygen, nutrients, and other essential chemical elements to the body's tissue cells and removing carbon dioxide and other waste products via the bloodstream. The heart is highly efficient, muscular organ that pumps blood to the body. It is about the size of a closed fist and is found in the thoracic cavity between the two lungs, behind the sternum and slightly to the left of the midline. The heart is divided into 4 chambers, right and left upper chambers called atria, and right and left lower chambers called ventricles. The right anterium receives oxygen-depleted blood from the veins of the body and, through valves, delivers it to the right ventricle, which in turn pumps the blood to the lungs for oxygenation. The left atrium receives this oxygen-rich blood from the lungs and delivers it to the left ventricle to be pumped to the body through the arteries. There are arteries throughout the body including the blood vessels that supply the heart itself, which are the coronary arteries. There are four main components of blood: red blood cells, white blood cells, platelets, tetus, and plasma. The red blood cells carry oxygen to the cells of the body and take carbon dioxide away. This is carried out by hemoglobin on the surface of the cells. Red blood cells give blood its red color. White blood cells are part of the body's immune system and help to defend the body against infection. There are several types of white blood cells. Platelets are a solid component of blood used by the body to form blood clots when there is bleeding. Plasma is the straw-colored or clear liquid component of blood that carries the blood cells and nutrients to the tissues, as well as waste products away to the organs involved in excretion. Okay, next we're going to be discussing the nervous system. The nervous system is the most complex and delicate of the body systems. The center of the nervous system, the brain, is the master organ of the body and regulates all body functions. The primary functions of the brain are the sensory functions, motor functions, and the integrated functions of consciousness, memory, emotions, and use of language. See, anatomy of the nervous system. The nervous system can be divided into two main anatomical systems: the central nervous system and the peripheral nervous system. The central nervous system consists of the brain and spinal cord. Both are encased in bone, the brain within the cranium, and the spinal cord with the spinal column are covered in several protective layers called meninges and are surrounded by cerebrospinal fluid. The brain itself can be further divided into the cerebrum, the largest and outermost structure. The cerebellum, also called the small brain, which is responsible for coordinating movement, and the brainstem, which joins the rest of the brain with the spinal cord. The brainstem is the control center of several vital functions, including respiration, cardiac function, and vasomotor control. The peripheral nervous system is the portion of the nervous system located outside the brain and spinal cord, which includes the nerves to and from the spinal cord. These nerves carry sensory information from the body to the spinal cord and brain, and motor information from the spinal cord and brain to the body. The nervous system can be also divided into two functional systems, the voluntary and autonomic systems. The voluntary system controls movement in the muscles and sensation from the sensory organs. The autonomic system is involuntary and controls the involuntary muscles of the organs and glands. It can be divided into two systems, the sympathetic and parasympathetic systems. The sympathetic system controls the body's response to stressors such as pain, fear, or sudden loss of blood. These actions are sometimes referred to as the fight or flight response. The parasympathetic system works in balance with the sympathetic system by controlling the body's return to a normal state. Now we're going to discuss the integumentary system. The integumentary system consists of the skin, hair, nails, sweat glands, and oil glands. The skin separates our tissues, organs, and other systems from the outside world. The skin is the body's largest organ. It has 3 major layers, each consisting of other layers. The epidermis, the outer layer, contains the skin's pigmentation or melanin. The dermis, or second layer, contains the blood vessels that supply the skin, hair, glands, and nerves, and is what contributes to the skin's elasticity and strength. The deepest layer, the subcutaneous layer, is made up of fatty tissue and may be of varying thickness depending on its positioning on the body. The skin serves to protect the body from injury and from invasion by bacteria and other disease-producing pathogens. It helps regulate fluid balance and body temperature. The skin also produces vitamin D and stores minerals, blood supplies, and skin with nutrients and helps provide its color. When blood vessels dilate, become wider, the blood circulates close to the skin surface, making some people's skin appear flushed or red and making the skin feel warm. Reddening or flushing may appear in darker skin tones. When blood vessels constrict, become narrower, not as much blood is close to the skin's surface, causing the skin to appear pale or ashen and feel cool. The pallor can be found on the palms of the hands of people with darker skin tones. The endocrine system. The endocrine system is one of the body's regulatory systems and is made up of ductless glands. These glands secrete hormones, which are chemical substances that enter the bloodstream and influence activity in different parts of the body. There are several important glands within the body. The hypothalamus and pituitary glands are in the brain. The pituitary gland, also referred to as the master gland, regulates growth as well as other glands. The hypothalamus secretes hormones that act as the pituitary gland. The thyroid gland is the anterior neck and regulates metabolism, growth, and development. It also regulates nervous system activity. The adrenal glands are located on the top of the kidneys and secrete several hormones, including epinephrine, adrenaline, and norepinephrine. Noradrenaline. The gonads, ovaries, and testes produce hormones that control reproduction and sex characteristics. The pineal gland is a tiny gland in the brain that helps regulate wake-sleep patterns. One of the critical functions controlled by the body's endocrine system is the control of blood glucose levels. The islets of Langerhans located in the pancreas make and secrete insulin, which controls the level of glucose in the blood and permits cells to use glucose and glucagon, which raises the level of glucose in the blood. The sympathetic nervous system is also regulated through the endocrine system. Adrenaline and noradrenaline produced by the adrenal glands cause multiple effects on the sympathetic nervous system. Effects include vasoconstriction, which is constricting of vessels, increased heart rate, and dilation of smooth muscles, including those that control respiration. The adrenal glands and pituitary gland are also involved in kidney function and regulate water. Sodium chloride and potassium balance. The body's work to keep water and levels of electrolytes in the body in balance. Next slide is the digestive system. The digestive system consists of the organs that work together to break down food, absorb nutrients, and eliminate waste. It is composed of the alimentary tract and the accessory organs that help prepare food for the digestive process. Food enters the digestive system through the mouth and then esophagus. The passageway to the stomach. The stomach and other major organs involved in the system are contained in the abdominal cavity. The stomach is the major organ of the digestive system and the location where the majority of digestion or breaking down takes place. Food travels from the stomach into the small intestine, where further digestion takes place and nutrients are absorbed. The hepatic portal system collects blood from the small intestine and travels its nutrients and toxins to the liver for absorption and processing before continuing to the heart. Waste products pass through the large intestine or colon, where water is absorbed, and the remaining waste is passed through the rectum and anus. The liver is the largest solid organ in the abdomen and aids in the digestion of fat through the production of bile, among other processes. The gallbladder serves to store the bile. The pancreas secretes pancreatic juices and aid in the digestion of fats, starches, and proteins. It is also the location of the islets of Langerhans, where insulin and glucagon are produced. Digestion occurs both mechanically and chemically. Mechanical digestion refers to the breaking down of food that begins with chewing, swallowing, and moving the food through the alimentary tract and ends in defecation. Chemical digestion refers to the chemical process involved with enzymes break foods down into components the body can absorb, such as fatty acids and amino acids. Next slide is the urinary system. Part of the urinary system, the urinary system consists of organs involved in the elimination of waste products that are filtered and excreted from the blood. It consists of the kidneys, urethra, and urinary bladder. Uterus, urethra, and urinary bladder. The kidneys are located in the lumbar region behind the abdominal cavity, just beneath the chest, one on each side. They filter waste from the circulating blood to form urine. The ureters carry the urine from the kidneys to the bladder. The bladder is small, muscular sac that stores the urine until it is ready to be excreted. The urethra carries the urine from the bladder and out of the body. The urinary system removes waste from the circulating blood, thereby filtering it. The system helps the body maintain fluid and electrolyte balance. This is achieved through buffers, which control the pH in the urine. The next slide is the reproductive system. Part of the genitourinary system, the reproductive system of both men and women, include the organs for sexual reproduction. Male reproduction system. The male reproduction organs are located outside the pelvis and are more vulnerable to injury than those of the female. They include the testicles, a duct system, and the penis. Puberty usually begins between the ages of 10 and 14 and is controlled by hormones secreted by the pituitary gland in the brain. The testes produce sperm and testosterone, the primary male sex hormone. The urethra is part of the urinary system and transports urine from the bladder. It is also part of the reproductive system through which semen is ejaculated. The sperm contributes half the genetic material to an offspring. Female reproductive system. The female reproductive system consists of the ovaries, fallopian tubes, uterus, and vagina, and is protected by the pelvic bones. Glands in the body, including the hypothalamus and pituitary glands in the brain, and the adrenal glands on the kidneys, interact with reproductive system by releasing hormones that control and coordinate the development and functioning of the reproductive system. The menstrual cycle is approximately 28 days in length. Approximately midway through the cycle, usually a single egg is released, which, if united with a sperm, will attach to the lining of the uterus, beginning pregnancy. The female's ovum contributes half the genetic material to the characteristics of a fetus. So on the next slide here, this is something that we are going to be discussing in person. Okay, here's a scenario. You are the emergency medical responder. As you get closer to the woman in the car, you see that she is clutching one side of her abdomen, just below the rib cage. Her passenger is holding his right hip and looks dazed. The woman in the minivan now exhibits shallow breathing and her pulse is weak. What would you do in this scenario? This is a scenario that we will discuss in person.